Welcome back. We're here with Dr. Steven Vale of the Acuity Laser Eye and Vision Center in Scranton, Pennsylvania. Dr. Vale, thanks for coming on the show.
My pleasure.
So few of us are blessed to have 20/20 vision. Dr. Vale has a laser center here where you can perform procedures where you can actually give people better than 20/20 vision.
That's the objective.
Tell me a little bit about LASIK surgery.
LASIK was invented in the early 90s by a doctor named Dr. Prolikaris in Greece, and the technique has been perfected since then by a number of other surgeons. The advantages to LASIK are many, but primarily, I guess the thing is that wow effect, the rapid recovery from surgery. We're seeing very well the first postoperative day, which other laser vision correction procedures don't provide. There are a number of other procedures that provide good vision over a period of several days or a week or so, but LASIK is the one where people can really see very well the next day.
How long have they been doing LASIK procedures?
Well, I trained in Canada with Dr. Tafor, who was the first person in North America to do it. And he started doing it in July of 1994. And then I started working with him actually just a month later.
Okay, for 11 years now, it's been done.
In the United States, it's only been FDA approved since late 1995.
Okay.
But what happened was the lasers were approved first in Canada, and were used for a much longer time. Even in the late 80s, people were performing PRK, an earlier form of vision correction, which we still do quite a bit, actually.
Okay. And you perform this procedure, is it good forever?
Generally, laser vision correction is very stable. There are a couple of situations where people may need touch-ups or enhancements later on. One of the things that can happen is if somebody rubs their eyes a lot, they may actually rub their eyes enough to give themselves astigmatism. That's actually the reason why many people have astigmatism, because they rub their eyes too much to begin with.
I never knew that.
A lot of people don't know that, so it's actually a good idea whether you have laser vision correction or not to rub your eyes.
Okay.
Rubbing your eyes is a bad habit, but people sometimes after surgery will start rubbing their eyes, even if they didn't before, they may rub them for allergies or some change in environment and actually get astigmatism.
Okay. Well, laser surgery is good for what types of eye problems?
Well, laser surgery does not correct cataracts, but for all kinds of refractive errors, laser vision correction is essentially useful. You can treat farsighted, nearsighted, people with farsighted with astigmatism, nearsighted with astigmatism, and even people with what's called mixed astigmatism, where they actually have astigmatism that's both farsighted and nearsighted astigmatism.
Okay.
So we can treat basically any refractive error. There are limits to what we can treat in that some people don't have enough corneal tissue to have a laser vision correction. That's actually rather rare, though.
Okay. Well, walk me through just the procedure in itself. I've studied a little of your literature, and you use a microkeratome.
That's a vibrating blade that oscillates at a very high rate, and what it does is it cuts an extremely smooth flap, which is actually a disc of tissue but still connected by a hinge to the cornea. We then lift it up and we perform the laser ablation intrastromally under the flap, basically.
Okay, so you take this blade that's got a curve to it similar to the curvature of the eye. Right. You shave a little layer off.
It looks like a contact lens. It's a very small, it's a little over 100 microns of tissue.
And then you flap that up, and then you perform the laser surgery underneath that.
Right.
Okay, and then what?
Well, we put the flap back down after we irrigate just to make sure there's no debris or any kind of materials in the interface, and then we put the flap back down, irrigate a little more.
Super glue it on?
Actually, no, you don't have to. The tissue adheres naturally just by the hydrostatic forces of the eye. The cornea has a natural pump that pumps fluid out of it.
Sure.
So what happens is when you put the flap down, it immediately starts getting sucked down to the tissue underneath, so you don't need stitches, you don't need glue.
Amazing. Just
put it down, and if you don't squeeze real hard that day and don't rub your eyes, it'll stay in place by the next day.
So you handcuff your patients so they don't rub their eyes?
Well, it's very important that you don't do that, but as I've told you, some people, are less compliant, and we have had to put flaps back in place.
Sure.
But although it sounds scary, that's actually not a big deal.
Okay, okay. And then post-operatively, what's the recovery and how well is their eyesight?
Well, we keep people here for a little while after surgery, about 45 minutes, just to make sure that they don't dislocate their flaps, because actually that's the most common time to dislocate. Then we send them home, they take some medicines, rest their eyes for a couple hours, and we actually, not to do any strenuous activities. And they can just usually resume most of their normal activities the next day, although, it's nice if you can take a day off or two from work.
Sure.
We do perform surgery on Friday. So
and
that
you give them a note, you can stay home
Sure,
for the
yeah,
next 2 days.
sure. Now, there are other forms of laser vision correction that do require you to take a few days off from work.
Okay.
We do those here also.
Okay, you said that the flap is your most common complication. What are other potential complications of the surgery?
Well, everyone gets to some degree some dry eye. Naturally, people reflex tear when their eyes get dry. The LASIK procedure severs some of the nerves that sense dryness. Because of that, we have everyone actually supplements their tears after laser vision correction, and that's something that everyone needs to do. Initially quite a bit for the first couple of weeks, and then decreasing over a period of months after that.
So saline drops in their eyes.
Artificial tears, right?
Artificial tears.
And for the first month they use them so frequently, they actually have to use the non-preserved type.
Okay.
After that, generally they're not using them that often, so they can just... And generally after about 3 months, sometimes in a slow healer a little more, but usually 3 months the normal corneal sensation returns and then they don't even need tears.
Okay. So they might get dry eye. Very rarely the flap will come up and you'll have to put it back down.
Mm-hmm.
Any other possible complications?
Well, there's always a risk of infection or inflammation after surgery, but with the medicines we have today, those things are actually very rare.
Sure.
The other thing that sometimes happens is that people will heal more than we expect. And they need a touch-up or what we call an enhancement.
Okay.
It really is just, if somebody didn't get all the way to the full correction of vision, it's still possible to touch them up in most cases.
Okay.
And perform that. Actually, that's not that common. Nationally, it's about 12% of people. I'm very proud to say here we only have about a 3 to 4% enhancement rate.
Wonderful.
So we really, employ the latest techniques and we're very cautious about how we treat our patients so that we get the best possible results the first time.
Sure. What sets your laser center apart from the others that are in this area?
Well, most laser centers have one laser system, and they may try to pigeonhole some people who maybe should have surgery on a different laser. For instance, if you had very large pupils, there's a laser system called the Vizix laser, which is not necessarily the best system for people with large pupils. So I have a Vizix laser, but I also have this Nidec laser, which is behind us here, which is useful for people who have larger pupils.
Okay.
The other thing that we have here is our microkeratome system allows people to have flaps with the flap hinge orientation is sometimes critical. Some of the flap creation systems only allow you to put a hinge superiorly. Interestingly, people have discovered that if you put a hinge superiorly, you may get more dry eye than if you put the hinge nasally.
Huh.
So we have a system where we can put the hinge nasally or superior.
Okay.
Exactly. And because of that, if I have somebody who comes in with dry eye, I see they're going to have a problem with dry eye, I'll put the hinge nasally.
Mm-hmm. You've given us some marvelous information about eye care.
Well, thanks for coming.
We appreciate you coming on the show.
Thank you.